Hello, it is Ryan, and we could all use an extra bright spot in our day, couldn't we? Just to make up for things like sitting in traffic, doing the dishes, counting your steps, all the mundane stuff. That is why I'm such a big fan of Chumba Casino. Chumba Casino has all your favorite social casino-style games that you can play for free anytime, anywhere with daily bonuses. That should brighten your day a little. Actually, a lot. So sign up now at ChumbaCasino.com. That's ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.
Hey all, welcome back to the Real Life Pharmacology podcast. Thank you so much for listening today. Definitely go check out reallifepharmacology.com. Get your free 30-plus page PDF on the top 200 drugs. Great little study guide, just refresher for clinical practice pearls. As well as I put on there things that commonly come up on board exams. So really wanted to provide that resource for you guys, especially those of you that might be doing a little brushing up, a little studying on pharmacology. So go subscribe. We'll get you updates as well when we've got new podcasts and content available as well. So again, reallifepharmacology.com. All right, so let's get into the drug of the day today. And we are going to talk about Palivizumab. Brand name of this medication is Synagis. And this medication is really specific to pediatrics. It's not a topic I talk about a ton because there's so much complicated things that happen in the adult and geriatric space. But I did have a request to take a peek at this medication and run down some details. So, knowing that it's not typically used in adults and geriatrics, what do we use this for? So, this medication is actually used in the prevention of respiratory syncytial virus. Okay, and that's more commonly, I think, talked about or known as RSV because it's easier to say as well. RSV is a respiratory infection, obviously respiratory syncytial virus, caused by a virus, obviously. And most older age adult patients have zero issues with RSV. And really symptoms are like the common cold. But younger patients, particularly under the age of 1 or 2, can potentially struggle with RSV to a much greater extent, to the extent that they have difficulty with breathing and things of that nature. And particularly patients who have really troublesome symptoms with RSV are those that have had lung disorders and lung heart development issues. And those patients are often premature or prematurely born. So with that, this medication is going to be used in patients that are under the age of 2, preemies or premature babies, and often they'll have lung immunocompromised situations, heart disease, and if they get infected with RSV, they are at much greater risk for complications and death due to RSV infection. Okay, so it's like, well, this all sounds well and good. Why don't we use this for all patients under the age of 2? Well, there is a substantial cost component associated with this medication. I'll talk about that a little bit later. But this medication, in suppressing that RSV infection, it does so by essentially, binding up and neutralizing or blocking the action of RSV and preventing it from replicating and growing. And we use this palivizumab, or this drug, preventatively to lower that risk of significant infection. Okay, so probably one of the most important things that comes up is, well, who do we give this medication to? I mean, who gets it? And I'm not going to go into incredible detail because these guidelines have changed over the years, and I anticipate they'll change going forward. But think about babies that are born less than 32 weeks gestation. I mean, that's when you're really going to start to think about using this medication to prevent RSV, and especially babies that were born less than 29 weeks gestational age there. So again, under the age of 2 and looking at that premature baby status and where they're at. And then, of course, if they have significant risk factors as well, such as, pre-existing lung disease, did they have difficulty breathing when they were first born, and things of that nature too. So there's definitely some clinical judgment in who gets palivizumab and who doesn't, or who should or shouldn't. But those are kind of some of the things to think about clinically. And then, of course, if you want the specific nitty-gritty details, I'd encourage you to go look at the American Academy of Pediatrics, so the AAP guidelines there. So this medication, what about things like adverse effects? Well, this is a monoclonal antibody. And it is an injection. So the most common things that are going to come up are skin type reactions, a low chance for anaphylaxis and that type of reaction, and then fever potentially is reported as well there. So really not incredibly large amounts of adverse drug reactions, but think along the lines of allergic type reaction and fever as far as the most common things that come up, with a very low potential for anaphylaxis. There have been case reports of that happening. In addition to that, I do want to talk about antibody development. There is a potential low risk of that happening as well as we give this medication over time. So our body can actually develop antibodies to the drug that actually bind the drug and neutralize the drug, which obviously, as you can imagine, would not be a good thing. So that can happen. It's pretty low percentage-wise, but it is important, I think, to at least be aware of it. So dosing, it is dosed based upon weight, which in pediatrics is the way we dose a lot of medications as well. It's an IM injection once monthly, and it's given to prevent RSV. And RSV is typically seasonal. So the highest risk is in that fall-winter phase, typically for us in the northern hemisphere here. And it is only recommended to do, at least at this time, it's only recommended to do a max of 5 doses per season. Okay, so those are important couple of things to remember, making sure that we have that appropriate stop date on that palivizumab. All right, so I think that's going to wrap up the first section. I'll take a quick break, and then I've got a couple of clinical pearls that I wanted to mention, and we'll talk about drug interactions, of course, as well. If you're in the market for Pharmacist Board certification study material, such as ambulatory care, pharmacotherapy, geriatrics, or medication therapy management, definitely go check out meded101.com/store for entire packages of content, from practice questions to webinars, recorded lectures. We've got all sorts of content to help prepare you to pass your exam. In addition, we've got NAPLEX content as well. We've got links there at meded101.com/store, so go check that out if you're preparing for that. If you're looking for clinical practice pearls and more education on medications in general, go check out our list of Audible books. You can get your first Audible book absolutely for free. I've got a book on pharmacotherapy practice pearls, got a book specifically on drug interactions, and you can get 6, 8, 10 hours of Audible content absolutely for free if you've never tried an Audible book before. So again, links to all that at meded101.com/store, STORE. All right, finishing up on drug interactions and a few clinical practice pearls that I wanted to mention. So, drug interactions. There really aren't any clinically significant drug interactions with palivizumab. So that is absolutely awesome. And if you think about it, it's like, pediatric patients generally aren't on a lot of medications to begin with. So that's definitely a nice thing that we really don't have to have our radar on too much for drug interactions there. However, I did want to mention a couple of things clinically about this. One in particular is lab testing. So there is potential if we are looking and assessing for RSV that lab test may give a false negative if the patient's taking palivizumab. And right, I think this kind of makes sense that if we're giving a drug that kind of blocks or blunts RSV and its replication, that it could potentially hide that infection a little bit there. So that's definitely one thing that is important to think about. If you see a patient getting palivizumab, it's on their medication list, and we're testing for RSV, just keep that in mind, that has been reported that there may be erroneous tests there. And then last thing I wanted to mention was, why don't we give this drug to everybody? Well, it's very, very expensive. For a 5-dose course throughout RSV season, you might be looking at 10, 15, 20K. So very, very expensive medication. So rough cost, again, it depends upon dose and the dosage form that we're utilizing there. But rough estimates of cost, you're looking at, 2 to 3 to 4,000 per injection. So very, very significant cost associated with this medication. So that is important to think about and assess, and particularly as we're considering giving this drug, working with that patient and insurance coverage or whatever the case may be, making sure that this is going to be something that can be afforded, and looking at, various programs or grants or anything that, the patient and their family may need to help afford this in the event that insurance coverage isn't there, or, something else is preventing them from having this drug adequately covered. So very, very important in many, many drugs that we think about cost of medications, okay? And we need to make sure that our patients are going to be able to afford what we're prescribing. And if they can't afford it, and it's absolutely necessary, we've got to do our best to figure out a way to try to get them help in any way we can. So definitely an important message there, and things to think about when giving this drug and many other brand name and costly medications that are out there. All right, so I think that's going to wrap up the podcast for today. Thank you so much for listening. Hopefully you picked up a few practice pearls and brushed up on some education today. Leave us a rating review on iTunes if you enjoyed the podcast. Share it with a colleague, friend, and students that you may have worked with, things like that. So thanks again. Take care, and I hope you have a great rest of your day.
Hello, it is Ryan, and I was on a flight the other day playing one of my favorite social spin slot games on ChumbaCasino.com. I looked over at the person sitting next to me, and you know what they were doing? They were also playing Chumba Casino. Coincidence? I think not. Everybody's loving having fun with it. Chumba Casino is home to hundreds of casino-style games that you can play for free anytime, anywhere, even at 30,000 feet. So sign up now at ChumbaCasino.com to claim your free welcome bonus. That's ChumbaCasino.com and live the Chumba life.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.